While steeped in history, Cherokee Nation is progressive in its thinking. They've been looking at the whole picture of wellness for some time now.
Behavioral health is the term the Indian Health Service uses for basically blending social work, mental health, and substance abuse services into one domain. I like that title because I think traditionally there's been a huge split between substance abuse and mental health services, and even to the notion that they're so different that they don't do the same thing.
Staff at the tribe's Behavioral Health Center look at root causes and risk factors for each patient.
If you prevent one, you're going to prevent the other. A lot of the interventions anymore are very similar. You don't see that many people who abuse substances that don't have another sort of mental health or behavioral issue. So treating addiction in a vacuum like it's not part of a larger phenomenon is not getting the whole picture.
To really get how it all works, you first must understand a bit about the area and its people.
Cherokee Nation is 14 counties within northeastern Oklahoma. It's relative in size to the state of New Jersey. We have a very diverse group that we have to work with. We have cities, we have small towns, and then we have very rural areas.
It's not an Indian reservation, but rather a sovereign government within a government, serving more than 315,000 people from its capital in Tahlequah, Oklahoma.
The state, county, and municipal government still hold jurisdiction independent from tribes, so we are part of a larger, more diverse population. So we work and go to school and live next door to non-natives, to non-Cherokees, to members of other tribes that live in this part of the state.
At one time, Cherokee people lived on about 81 million acres in the southeastern U.S.
The Cherokee people were the mountaineers of the southeast. Originally, we lived in 8 current-day states. Our culture was, for the most part, agricultural.
Historically, substances were only used during traditional ceremonies and not for pleasure. Then the European colonists came along.
Our cultures had really no time to develop social norms around social consumption of alcohol, casual consumption of alcohol, when it is and isn't appropriate to consume alcohol.
As the tradition of only using substances for ceremonial purposes began to erode, other tragedies came, one after another. The most well-known is the Cherokee Trail of Tears, which forced the tribe to move from its original land to what is now the state of Oklahoma. Thousands died during that march across the country, continuing a cycle of historical trauma.
So you have generations of people who've been displaced, removed from their homelands or removed from their traditional ways of life, and never really given a break to sort of settle down and reestablish themselves before the next thing hits.
Many of the Cherokee people looked for ways to cope.
I think that instead of using what we might find in our environment to help us with, we begin to develop some crutches or some addictions, maybe substance abuses along the way.
Now, the rate of substance use for Native Americans is higher than for other demographics.
And then so just one thing after another until you've got generation after generation after generation who have experienced or are growing up on the heels of their parents experiencing a pretty traumatic, disruptive event that tears the community apart, it tears at the fabric of the culture.
The culture is also what is helping the Cherokee community heal itself.
I, personally and professionally, believe that supporting cultural activities, ensuring that culture is an aspect that we utilize in every situation that we possibly can. By using culture as a protective factor, we can both encourage and support Cherokee culture while also preventing some of these issues that are going on in our communities.
The coalitions within Cherokee Nation are part of the solution.
We help the coalitions become better and to assist them in getting outcomes. And while doing so, we ensure that there's a cultural competence to what they do.
One of those coalitions is the Grand Nation, centered in the town of Veneta, where 2 major railroads intersect and historic Route 66 runs right through town.
We are the far northern part of Cherokee Nation. People, their families have been here since before statehood.
The coalition is using Cherokee culture to protect future generations by taking a game with huge historical significance and bringing it into the modern age.
Stickball is my anti-drug. At the turn of the century, the elders in the tribe made stickball community style. And they did so because the communities were losing that connectedness to those traditional beliefs. And what's really cool about the Cherokee culture is they implemented prevention science. So when those elders said, we're going to play stickball community style from now on, it brought people together.
Cherokee language immersion programs are also helping rebuild traditions, so future generations hopefully won't face the problems of the past.
I think that without our cultural identity, we'll just be brown people. If we don't have our language and our oral tradition, we won't know the difference between a Cherokee person and another tribe. Our culture, even though it's something that's hard to put our finger on, it's the values, behaviors, and beliefs that are passed from one generation to the next. A lot of times it's on accident, but as we take this into our own hands and we try to perpetuate our own identity, we'll strengthen ourselves. And I think that not only will we benefit from that, I think that our neighbors and our friends will as well.